I'm Anthony Robart. We are waiting for the latest update from Prime Minister Justin Trudeau. He is expected to deliver his address from outside Rideau Cottage, his home, in about now 30 minutes. His usual address is about 11:15. It has been delayed by 15 minutes. So while we wait, let's bring you up to speed on some developing news. We are expecting to hit the 1 million mark in terms of worldwide confirmed cases of COVID-19 sometime in the next 24 hours. There you see on the board 870,000 cases right now. The number of deaths approaching 50,000. About 1/5 of the worldwide cases, in fact, are in the United States, where there are now more than 160,000 people infected. And here at home in Canada, more than 8,500 people have tested positive. Now, across our provinces, the numbers, unfortunately, continue to rise. Quebec remains the hotspot with nearly half the cases in the country, more than 4,100 cases. Next door in Ontario, it saw its biggest one-day spike. There are now almost 2,400 cases there. Out west, British Columbia now has more than 1,000 confirmed cases. So across the country, as we total up the numbers, 100 people have died so far. Now, as you just saw, Quebec is, of course, grappling with nearly half of the recorded cases of COVID-19 in Canada. And Premier François Legault says that province is just days away from a major shortage of crucial medical supplies. Legault says Quebec has only 2 to 6 days worth of personal protective equipment. This includes masks and gloves. He says the province has gone through, get this, the equivalent of a year's worth of equipment in just 4 weeks.
It's really the top priority right now. Make sure that we'll have enough medical supplies in the next few weeks. And I want to ask again to the health professionals, please use only the supplies when it's necessary.
Now, in Tuesday's address yesterday, the Prime Minister pledged $2 billion for personal protective equipment. Ottawa has been in touch with more than 3,000 companies eager to help. 3 have been contracted to help with this crisis. Let's look in Canada's biggest city. Toronto has canceled all major events until at least July. That includes conferences, concerts, and Canada's largest Pride Parade. Mayor John Tory says it was a difficult decision, but one that will protect and save lives across the city. Meanwhile, the city's medical officer of health is now working with the province to implement even stronger measures. Those include enhancing physical distancing, further limiting which businesses can open, and greater protections for those who are most vulnerable. Now, also in the news, it is a day later than promised, but Canadians, we should all learn a little bit more about the federal emergency wage subsidy program. Still a lot of questions surrounding that. And that includes the multi-billion-dollar price tag. A planned news conference with Finance Minister Bill Morneau and Small Business Minister Mary Ng was postponed yesterday. Officials were ironing out the final details on this, but there's some politics at play as well. They'll try again today. We'll be joined by Innovation Minister Navdeep Bains. Well, the Prime Minister said to address the nation at about 11:30. He's been delayed, as I mentioned, by 15 minutes or so. Let's go to Abigail Beeman in Ottawa with a preview of what we can expect today. What are you hearing, Abigail?
Good morning. So we are hearing that the Prime Minister is expected to speak more about the CERB, the Canada Emergency Response Benefit. In your opening comments, we were talking about the 75% wage subsidy. The CERB is different from that wage subsidy. That is going to be direct help for Canadians, for anybody who has lost their job as a result of COVID-19, if they're parents who have to stay home, if they don't feel safe going to work, if they're quarantined. It's supposed to be help for all those people to the tune of up to $2,000 a month for 4 months. There's still a lot of questions about that. The latest information we have is that the online portal where people should apply for this will open April 6th, and then it will take 10 days for that money to roll out. A couple of notes that the government keeps stressing. They want everybody who thinks they're going to need this money to set up an account on the CRA website under My Account to get the ball rolling for when the portal officially opens. And they're also encouraging everybody to sign up for direct deposits. They want as much of this money to flow through direct deposits into Canadians' bank accounts as possible, rather than having to deal with checks or a slower method. But that CERB was announced before this major hike to the wage subsidy. Remember, initially it was a 10% wage subsidy. Now we're looking at a 75% wage subsidy. And I think there are a lot of questions here about what Canadians should be going for, because with the wage subsidy, the goal of that, as the Prime Minister has said very clearly, is to keep Canadians on the payroll, is to rehire people who were laid off because of this amount. And when you compare the weekly amount from that wage subsidy, the max there is $847 a week compared to $500 a week for the emergency response benefit. So some questions there, and perhaps we'll get some more information from the Prime Minister about the CERB and how it will roll out today.
Yeah, and speaking of the wage subsidy, I mean, according to a latest survey, about 30% of these businesses won't even expect to stay in business after this is all said and done. And a lot of them can't take on that loan because, look, that might be the only way. The wage subsidy will pay for employers or the employees, but what about the overhead costs?
Well, there are still so many questions about that wage subsidy. Now, a lot of them were answered on Monday. So just to sort of set up the time frame here, we first learned about this change to the wage subsidy, increasing from a 10% to a 75% wage subsidy on Friday. But there were very few details whatsoever. A lot of nonprofits were panicking. Businesses, of course, still have a huge number of questions. Then on Monday, the Prime Minister made a very significant announcement when he said that it doesn't matter what size business you are, because initially he had said small and medium-sized businesses. Everybody was asking, well, how many employees do I need to qualify for those numbers? As of Monday, the Prime Minister says it doesn't matter what size business you have. What matters is if you've seen a 30% drop in revenue because of the coronavirus. That still has a lot of businesses asking questions. What if you're a new business and you don't have year over year to compare to from last year? What if less than a 30% revenue is, or what if losing less than 30% of your revenue is still going to put you out of business? Those are some major questions, along with, as you mentioned, the price tag for all of this. And now finally, we're expecting to have more answers from the Finance Minister this afternoon. But again, first announced on Friday. Here we are on Wednesday. Here we are at the beginning of the month, and there are a lot of nervous businesses looking for more information.
Well, this is just it. Rent is due, mortgages are due, a lot of anxiety surrounding this from so many people. Talk about and just sort of illustrate the messaging so far from the government. Can anyone across this country expect any help from the federal government?
Prime Minister has been asked about this a lot with this April 1st deadline, and here we are today looming. Global News asked him about it yesterday. He first spoke about the CMHC and the deferral of mortgage payments up to 6 months, which should help some people. But there's been some confusion around that, people not sure if they qualify, not sure how to move forward. It really struck me from the Prime Minister's comments yesterday that when he was asked what are people supposed to do who can't pay their rent by April 1st, the Prime Minister started his sentence by saying we've put more money in people's pockets through the wage subsidy. He then corrected his tense to say we're putting more money into people's pockets with this wage subsidy. But businesses don't even know how to apply for this wage subsidy, and it's April 1st. So that's a serious lack of information for somebody whose rent is due today and they don't know how to apply for the program. But that's what we are hearing from the feds so far, and it's a question that's asked over and over again. There has been some help from different provinces, particularly in British Columbia and Ontario, where evictions have been frozen. In BC, there is some financial aid being offered, as well as a freeze on rent increases. Ontario Premier Doug Ford has said in a number of different ways that if you can't pay your rent, don't pay your rent, but if you can pay it, you absolutely must pay it. So there's been some messaging around that, but still so many people with questions, so many people facing financial hardship, and here we are at the beginning of the month.
Yeah, you mentioned British Columbia, $500 for renters. And also some landlords are allowing the renters to use what they would have paid or they paid in their last, because they paid that anyway. It's their money, to use that at least now, but it doesn't necessarily get them through this entire economic crisis. Let's shift to the personal protective equipment. We mentioned off the top the $2 billion that was allocated yesterday for ventilators, masks, other PPE. Any timeline on this?
There are some timelines on this. The Prime Minister spoke about things arriving in the coming weeks. We know that masks and ventilators are arriving starting this week, but I still believe that we don't have a clear picture on everything. So yesterday, after the Prime Minister spoke, we got some new details from the Procurement Minister. We learned 157 million masks have been secured. 60 million of the N95 masks have been secured. The government has ordered 1,570 ventilators. They're looking to find 4,000 more ventilators. They won't say how many test kits they've secured. That's another detail. And they were not giving full details in terms of when this will roll out, and more importantly, the context, the need. What is the planning? How much of this equipment will we need over the next weeks and months? Of course, as the Prime Minister did say yesterday, a large part of that is up to Canadians, whether people follow the rules of social distancing, whether people stop the spread. There is an element of this that we just don't know in terms of how much equipment we will need. But of course, there's planning being done. We also get different pictures from right across the country. So we will see exactly how this need is going forward, but we're certainly hearing from frontline healthcare workers now who are nervous. One emergency room doctor that I spoke with yesterday says, thanks for the help. If this arrives, that's great. But first of all, it's too late. And second of all, she says we should be having more gear. And here we are begging for one mask when much more is needed. So a lot of questions on that as we see that gear come in.
Yeah, the unfortunate reality, because going into this, we hope that we are a little more prepared. Some are saying that the mobilization came a little too late, perhaps. Abigail, thank you so much. We'll touch base later on. Abigail Beeman joining us from Ottawa, and there you see a live shot outside Rideau Cottage, where in about less than 20 minutes, in fact, the Prime Minister will be speaking his daily address. The media just setting up there. This is where he has been in isolation, working from home, really ever since this crisis began, ever since we've all been asked effectively to stay at home and work from home. Let's go south of the border now. The United States is now the epicenter of the global COVID-19 pandemic. Close to 4,000 deaths, and unfortunately that number expected to grow exponentially. Washington Bureau Chief Jackson Prosco is standing by with the latest. Hello, Jackson. Thank you so much for joining us. So set the scene in the United States and really the grim projection, the realization as well of this real potential coming out from the White House and how that narrative has changed. Get us up to speed on that.
Anthony, good morning to you. The White House revealed shocking numbers yesterday, the models that they're using to inform their decision making as this crisis unfolds. The best case scenario they are now looking at is 100,000 to 240,000 fatalities in this country as the coronavirus pandemic unfolds. At the peak in mid-April, they estimate we could see more than 2,200 deaths per day. Anthony, the numbers, as you mentioned, are growing very, very fast. There were more than 850 confirmed fatalities in this country yesterday. There will likely be more than 1,000 in this country today at current rates. So that gives you a sense of how rapidly this is unfolding. Of course, the real concern is the strain that all of this is going to put on the healthcare system. But bottom line, all they can do right now is wait it out, see if these social distancing measures have actually worked. Anthony, those same models that gave those grim predictions said that if the U.S. did not take social distancing measures, did not urge people to stay at home the way they have so far, you could see upwards of 2 million fatalities in this country.
And New York, especially hard. Talk about that and how that state, and especially New York City, is handling this.
Yeah, there have been more than 1,000 fatalities in New York State already. That state has been hit very hard. It is sort of the early wave, and New York's governor has said time and time again, they're the canary in the coal mine for what the rest of the country could expect to see in the coming days and weeks. They say their models show a sort of wide range and potential for when the epidemic might reach its apex. It could be sometime between the next 7 and 21 days, so a week to 3 weeks away. Already they're running short of critical supplies like ventilators, masks, gowns, and gloves. For hospital officials are in short supply as well. We've seen the stories in recent days of doctors and nurses wearing garbage bags as gowns, or wearing patient gowns as their own protective equipment because everything is in such short supply. And of course, there's been grim footage emerging as well of bodies being loaded by forklifts into refrigerated trucks outside those hospitals because they simply don't have room for either the living or the dead inside their hospitals. There's now a temporary field hospital up and running in New York Central Park. The Javits Center, which is a huge convention center in Manhattan, has been converted into a field hospital with a capacity of up to 2,500 beds. It's now accepting patients. And Anthony, they are looking for similar sites to the Javits Center in arenas and convention centers right across the state to cope with expected demand.
A grim reminder of the situation in the United States. And we talk about New York State, but basically this has affected every state and every territory, hasn't it? And it's complicated in many ways by each state's response. Expand on that if you could.
Yeah, let me give you a couple examples here. Florida is one place where they're seeing their case numbers and deaths start to rise. And there's a huge population of seniors in that state. And yet Florida's governor has refused so far to issue any sort of statewide stay-at-home order. It's a program called Safer at Home, where they're encouraging people, especially in counties surrounding Miami, to stay at home, especially if they're over the age of 65 or have an immune deficiency. But there's no order. There's nothing compelling people to stay at home. And Florida's governor has simply said that unless the federal government steps up and issues a national directive, he won't consider any other advice at this point. Compare that to here in Washington, D.C., where today is day one of a mandatory stay-at-home order. You are not allowed to leave your home for anything other than groceries, medical services, or home essentials, essentially, if you have to go pick up a prescription or if you need somebody to come in your house to do emergency repairs. Those are the only things that are allowed, and you face the threat of fines or jail time if you violate the order. Michigan is another state that's rapidly emerging as a hotspot. Now, orders there are a little more strict, but Anthony, what we're actually seeing are anecdotal reports of Canadian healthcare workers who live in the Windsor area but travel to Detroit to work in hospitals, now bringing infections back to Windsor. And reports suggest roughly a third of the new cases popping up in the Windsor area are Canadian healthcare workers who work in the U.S. and travel across the border. So I think all of this gives you a sense of the patchwork system that's in place here in the U.S. The White House so far has refused to issue any sort of national stay-at-home order or a national curfew. They've merely issued guidelines for the next 30 days, which are roughly stay home if you're over the age of 65, don't gather in groups of larger than 10. But again, they're guidelines. They're voluntary right now.
You have a sense, and you wonder if that narrative is going to change, because we hear different words coming out of the White House, certainly from the past 2 weeks, and now acceptance of the grim projection. Do you have a sense there in the United States that things will change? It will become even more restrictive, and not just a suggestion, a recommendation, but this is going to be the order. And is there an appetite for that?
The White House has been very reluctant to go down the path of talking about any sort of national stay-at-home order. They've been avoiding that, although today the U.S. Surgeon General kind of took a shot at Florida's governor and said, the guidelines that they've got out there, those voluntary guidelines, are effectively in order. In other words, you as a state leader should be following these guidelines and issuing them to your people. It's hard to know, though, if things continue to get worse, if the U.S. will have to take some sort of stronger action. We saw last week the president was toying with the idea of a quarantine for the tri-state area around New York. That's New York, New Jersey, and Connecticut. And ultimately, he backed down. There were legal questions as to whether or not he could actually enforce that. And in the end, the CDC simply issued sort of broad travel guidance for anyone leaving those areas to self-quarantine for 14 days. I think you're going to see things sort of unfold organically and on their own. So air travel is becoming harder and harder to do here in the U.S. The airlines are clawing back on their schedules, and that's really starting to restrict the amount that people can move freely within the country. But that's not because of a federal order. That's because of the economic collapse that's taking place. And some airlines have suggested they're all but going to cease flying except on a few key routes. Whether we see stronger federal measures, I think, really depends on the next few weeks and how this unfolds, and whether they get a sense that these state-level measures are actually having an impact in terms of controlling the number of cases and the number of deaths. Remember, we talk about that 100,000 to 240,000 range. That's a best-case scenario. Dr. Anthony Fauci, the leading expert at the White House, says be prepared for 100,000 fatalities at a minimum.
Yeah, I'm looking at the numbers right now as they're coming in, and 189,753 is the official number. But as you mentioned, I mean, this is changing by the minute. And right now in New York City alone, 1,096 deaths. It is a grim number, and it's incredibly unfortunate. Jackson, thank you so much. We'll touch base in a little bit. And if you were just joining us at home, we are still awaiting the Prime Minister to speak from his home at Rideau Cottage. There you see the podium set up. That is in about 10 minutes right now, delayed by about 15 minutes. We'll bring that to you live the moment he begins speaking. Let's return to the nation's capital and go to our Ottawa Bureau Chief, Mercedes Stephenson. Mercedes, and this is an incredibly troubling situation and number that we're hearing. You have a better idea of how long this COVID-19 lockdown could last. Best case scenario, obviously not good news. Elaborate on that.
Yeah, so I mean, people who were hoping this might be a few days, it's not. It's going to be months. And there was a report of the National Post this morning saying that they had gotten their hands on a government document that shows it being around beginning in July that they're looking at. We also know that restrictions on the people coming into Canada from other countries will be there until June 30th. And I've talked to sources who've been saying the same thing for days, that both within the city of Ottawa and federally, the best case plan documents and meetings that they're having would have the current social distancing and measures on businesses in place for 8 to 10 weeks. That's the best case scenario. That's if everybody complies and they're able to actually flatten that curve. Beyond that, though, Anthony, is the reality that there could be second and third waves of this virus, that as people come back out, and I know this isn't what anyone wants to hear right now, but just to give people a realistic expectation, as people come back out, some people will still have that virus, and it is not unusual with pandemics for there then to be a second or third wave. Whether or not they would then re-implement the social distancing protocols and the rules on businesses is another question. But keep in mind, you're not in this for a couple of days. Get cozy, get used to it, because it is going to be a while. And that, by the way, Anthony, has some saying, well, maybe social distancing isn't the best way. Maybe we should be looking at wearing masks instead. There's all kinds of debate about this right now in the scientific community, which is very interesting. At this point, the advice of the Canadian government is still very clear, and that is social distancing and non-essential businesses to remain closed. They believe, based on the advice of their officials, that currently is the best possible way forward for Canadians. Although I expect that you're going to hear the Prime Minister ask questions today about masks and about that advice, as some other countries have done things differently and some other health authorities are reviewing that scientific evidence. And to be clear, when it comes to the masks, they're not suggesting that wearing a mask will necessarily protect you from getting it. What some scientists are saying is there's a lot of people who have either very minimal symptoms of COVID-19 and don't actually think they're sick because they feel pretty good, or people who haven't started showing symptoms yet who could be shedding the virus, and that wearing a mask could prevent that virus from being transmitted to somebody who is not infected. So it's not about protecting someone from getting it as much as it's from protecting people from spreading it. And there's also a debate right now over whether or not you could use homemade masks to do that, of sort of double layered fabric, or masks that are not the N95 masks that those frontline first responders need to protect them, because what you don't want is a run on materials that Mercedes is vital for people in the medical community to have access
Mercedes,
to.
I'm going to have to jump in there. Prime Minister Trudeau is about to speak a little earlier than we mentioned. Let's listen in.
Every day, Sikh Canadians make our cities and our neighborhoods stronger. And right now, when people need help most, you're stepping up once again. In Regina, you're delivering supplies to your neighbors, while in Mississauga, you're donating to the Siva Food Bank. It just goes to show that we are all stronger together, supporting each other. You are doing your part, and so many others are doing the same. Aux gens qui sont aux premières lignes, merci. Aux agriculteurs, aux camionneurs, aux personnes qui livrent des cargaisons.
Persons that deliver air freight, nurses, doctors, you are working day and night so that we can eat and take our drugs to protect our health and the health of our families. Your government is there for you, and we all thank you.
Our government has introduced a 3-point economic plan to protect jobs, help people laid off, and support businesses. If you're worried about your job, we're helping your employer keep you on the payroll with the Canada Emergency Wage Subsidy. Later today, Minister Morneau, Minister Ng, and Minister Baines will provide an update about this 75% wage subsidy. But what I can say now is that it's going to be available for businesses, big and small, that are not publicly funded and have seen a 30% or more decline in gross revenues. That includes everything from bars and restaurants to charities and nonprofits. Applications will soon open through the CRA. Like I said on Friday, this money is for workers. Employers will need to attest that they're doing everything they can to pay the remaining 25% of people's wages. These are unprecedented times and will require us to pull together as a country and trust each other as Canadians. So there will be stiff and severe penalties for trying to take advantage of this system and of your fellow Canadians.
Our wage subsidy of some 75% is there for businesses, both large and small, that are not publicly financed and that have a loss of 30% or more of their revenues. This includes restaurants, bars, charitable organizations, and non-profit organizations. You will soon be able to submit your request on the Canada Revenue Agency website. This money is for workers. Employers who use the subsidy must do everything in their power to offer the 25% not covered by our wage subsidy to their workers. As I have said, we are living in an unprecedented situation. We are called to work together as a country and to trust each other. There will be considerable legal penalties for those who attempt to game the system and cheat people.
Unprecedented times. So we're taking unprecedented action. And while we put this measure in place, we're continuing to move forward on the other two prongs of our economic plan. To help business owners worried about rent or other bills, we've brought in new loans. To help people who lose their paycheck, whether they're freelance or have been laid off, we created the Canada Emergency Response Benefit. And on that front, I have some good news to share. Starting on the
6th of April, if you haven't already submitted a request for employment insurance, you will be able to submit an online request to obtain the Canadian Emergency Response Benefit. I'd like to remind everybody that if you receive the wage subsidy, you cannot collect the Canadian Emergency Response Benefits, one or the other. You can register by visiting canada.ca. When you submit your application, you can choose to receive your benefit by mail or by direct deposit. After, all you need to do is to confirm once a month that you remain without a job. Once again, if you've already submitted a request for employment insurance, you need not register again, not starting on the 6th of April. We will also implement measures to prevent systems to be overloaded by applications. Later today, Minister Duclos and Minister Qualtrough will provide more details about the process and the eligibility criteria.
You'll be able to apply for the Canada Emergency Response Benefit. A reminder, if you're getting the wage subsidy from your employer, you can't collect the CERB. It's one or the other. You can't get both of these benefits. For the CERB, you can register online at canada.ca. By selecting direct deposit, you should receive your payment within 3 to 5 days. If you can't apply online, don't worry. You can call the Canada Revenue Agency for help over the phone. By mail, you'll get your check within 10 days. After applying, all you need to do is keep getting this benefit is check in every month to say that you're still out of work. And if you've already applied through EI, you're all set up. You don't need to do anything on April 6th. We're putting measures in place so we don't overload the system, but I can assure you that everyone will get their money. Later today, Minister Duclos and Minister Qualtrough will have more details on this whole process, from eligibility to applying to getting your check. But the bottom line is this: we're getting you the help you need when you need it. We have a plan to protect jobs, to help those who've been laid off, and to support businesses that are having cash flow problems. And we're not done yet. We're going to keep working hard to make sure you're getting the support you need. This is the largest economic program in Canada's history. So I've asked the House Leader and the Deputy Minister to reach out to the other parties about bringing back Parliament. This must be a Team Canada effort. Governments of all orders across the country are stepping up to fulfill their responsibilities to Canadians. Canada hasn't seen this type of civic mobilization since the Second World War. These are the biggest economic measures in our lifetimes to defeat a threat to our health. These historic measures will support Canadians to stay home to defeat COVID-19. But the government alone cannot win this fight. We all have to answer the call of duty. This is service that most of us have never been called upon to do. We, each of us, have to live up to our end of the bargain. We must fulfill our collective responsibility to each other. Listening to public health rules is your duty. Staying home is your way to serve. So be smart about what you do, about the choices you make. That is how you will serve your country and how we will all serve each other. How well we do this right now determines where our country will be in 2 weeks or in 2 months. It's in our hands. It's in your hands. On a tous un rôle à jouer.
We all have a role to play. We have a common responsibility. Where we will be in a few weeks and a few months doesn't depend on me, but on you. I am appealing to your civic conscience to protect others. If you do not respect the directives, you are endangering others. We all have the moral obligation to stay at home. We all have the moral obligation to take care of each other. It is by working together that we'll get through it. It's by remaining faithful to our values that we will remain who we are as Canadians. Thank you.
Thank you. We'll now go to the phone line for one question and one follow-up. Operator?
Thank you. Merci. Première question, Michel Lamarche.
First question, Michel Lamarche, TVA News. Good morning, Mr. Trudeau. This morning, do you consider that it is part of your responsibility to be transparent about the equipment in reserve? Can you guarantee that we will not lack of protection equipment? Your ministers couldn't give this guarantee yesterday. Answer, in today's situation, we just can't guarantee anything. We are working very, very hard in order to fill the needs and ensure that the necessary equipment is properly distributed throughout the country, equipment coming from overseas, and also equipment coming from Canadian solutions to replace the equipment that we're using every day to keep our health worker safe. We shall continue to work with provinces and all the various administrations to meet these needs, but much depends on the choices that citizens will be making. How people behave today and in the weeks before us, the choices they will make in order to be able to control the pandemic as much as possible and continue to protect those who are working to protect us, health workers.
Yes, il y a une situation pressante.
There is an urgent situation with the surgical masks in Quebec. This, you heard it said. Can you tell Quebec that your way of facing up to that problem is to transfer part of the Federal Reserve to Quebecers? Well, of course. The Federal Reserve is there to help Canadians where they need it. I spoke directly to Premier Legault yesterday, who pointed out the challenges that Quebec is facing up to right now, and we're working very hard together to meet their needs. We're expecting equipment arrivals shortly, and we shall continue to expect other arrivals. We are seeking out the various resources available throughout the country and do everything necessary to ensure that there's no shortage. But we do understand that this is a very difficult situation and that we all have to do our share.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mia Rabson, the Canadian Press. Your line is open.
Good morning. I'm wondering if you could explain why the National Emergency Stockpile didn't seem to help keep the equipment in the hands of health workers that we needed, and whether or not we're going to use the Defence Production Act in order to fill the need.
The Defence Production Act that we've seen in the United States is about forcing and ordering companies who might not otherwise do it to step up and produce the necessary equipment for a wartime or crisis situation. Here in Canada, what we've seen is companies across this country putting up their hands and asking to do it, offering any help they can right across the country to switch their manufacturing over to necessary goods, necessary equipment. We so far have seen such an overwhelming response from businesses that we have no need of bringing in at this point a similar act. But of course, we'll always keep an eye on what we need to do in future situations or how we can adjust. And the federal stockpile has been ensuring over the past weeks that there is enough equipment across the country to respond to the needs that the provinces have asked us for.
We saw that in the United States they invoked the Defence Production Act. In Canada, we don't need to do that right now because the manufacturers and businesses throughout the country and the various factories have stepped up and volunteered to help us develop medical equipment. Now, obviously, I am taking nothing off the table, and if we ever do need to take stronger measures such as this, we will do so. But for now, I can only thank all the various companies that have offered to help us out and that are working to help fellow Canadians.
Follow up, Mia?
Yeah, I'm wondering if you could let us know what assurances you have from the Americans that they've dropped the idea of moving troops towards the U.S.-Canada border.
The ongoing conversations we have with the American administration continue on a broad range of subjects, and we have heard that is not something they're continuing to pursue, but we will, of course, continue to engage with the American administration as new situations come up and as things develop. I
can tell you that we continue to discuss matters with the American administration about the border and essential trade that goes between our two countries. For now, we have heard them state that they do not intend to move forward with this idea of sending troops to the border, but we continue to maintain open discussions.
Thank you. Merci. Prochaine question, Mélanie Marquis.
Next question, Mélanie Marquis, La Presse. Thank you. Good day, Mr. Trudeau. There's a shortage of medical equipment in Quebec right now. In the next few days, how is Ottawa going to concretely help? In the short term, the Quebec Health Network, we are working very hard with all provinces to see if there's ways of helping Quebec and other areas that need more equipment. But we're also working at the international level to ensure that we can receive deliveries of other equipment. For example, our embassy in China is working quite diligently in order to follow up on the material that we ordered. But it's a problem because there's very many countries in the world that are all going after the same equipment. But we are working and doing everything we can to ensure that nowhere in the country we will have a shortage. Now, there's still much work to be done, no? But can you tell us if we'll be getting something in before the end of the week or not? And on another topic, there's a government document that raises a scenario to the effect that the measures to fight COVID-19 will last until July. Can you say something about that answer? We do expect to receive some deliveries in a very short order, in a few days, even sooner. And with regard to these scenarios, as I have often said, we look at all kinds of different scenarios. It might last longer, it might last less time, and all of this will depend on the choices and the behavior of Canadians on a daily basis in order to keep ourselves safe and others safe. The choices that we make in our behavior, they have a direct impact on the length of time the crisis will last. But if we look at what happened elsewhere in the world, we see that even in countries such as South Korea, Singapore, where they managed to manage the crisis somewhat well, if I can put it that way. The measures still are continuing. People have to expect that we will be in such a situation for some many weeks, if not months.
Thank you. And one more question on the phone, please, operator.
Thank you. Merci. Next question, Eric Atkins, the Globe and Mail. Your line is open.
Hi there. Thank you. Given that Canadians returning from abroad are bringing confirmed cases of COVID-19 into Canada as recently as a few days ago, why are airlines and the government still bringing Canadians home?
That is a good but a difficult question. In Canada, we understand how important it is to keep Canadians safe. And we hope and are demanding that those Canadians who do return home self-isolate for 2 weeks. I know there are countries that have decided that people overseas or people elsewhere are not allowed to come home to Canada. That is not a choice we've made. We want Canadians to come home, but we also very much expect and demand that they keep themselves and their neighbors safe by self-isolating in rigorous conditions for 2 weeks as soon as they get home. We would much rather be able to have people home than have them stranded elsewhere around the world where things are getting, worse. Okay. En tant que pays, on a pris la décision.
As a country, we made the decision to have Canadians brought home if they're overseas. This is not the decision that other countries made. Various other countries have citizens that are caught abroad and can't come home, but we're trying to bring all Canadians back home because it's important that Canadians can come home where they will be safer. We also are implementing strict and rigorous measures so that the people who come home do not endanger other Canadians, their neighbors, our healthcare workers. That is why that is just so important that anyone coming back from abroad self-isolate for 14 days in order to keep us all safe, and in particular our healthcare workers.
And one follow-up.
I'm just wondering what the public health case is for allowing any Canadian to return.
The public health case is that if people who return properly and rigorously self-isolate, then we are not significantly increasing the risk to everyone else. It requires ensuring that they do indeed self-isolate, but in Canada, we try to look out for each other. That's been the characteristic of what we've seen over these past weeks. As people are there to help each other, people are making choices to make sure that they don't put themselves, their families, or their neighbors at risk. We see neighbors ensuring that food is dropped off to people who can't go out or are too vulnerable. We've seen volunteerism up extraordinarily, people calling up to volunteer as crisis counselors to go through the rigorous training to volunteer at Kids Help Phone. Canadians help each other when we're in tough times. And part of helping each other in tough times is making sure that Canadians who are stuck overseas can come home. But part of that responsibility that they have then is to make sure that they're not putting others at risk and make sure that they self-isolate.
Prime Minister Kevin Gallagher with CTV National News. Toronto's Chief Public Health Officer indicated today that these public health measures to mitigate the spread of COVID-19 could be in place for 12 weeks. There are, according to the National Post, internal federal government documents that also indicate these measures will be in place until July. You yourself have not shared these types of projections. Don't Canadians have a right to know how long these important yet disruptive public health measures will be in place for so that businesses can plan and families can plan?
We have been open and transparent with Canadians on the facts, and I've said from the very beginning that there are a wide range of scenarios that we have been looking for, that we're planning for, that we are trying to work towards as a government, as a country. We know that we are going to be in place for a number of more weeks, perhaps more months, but everything depends on how Canadians behave. The choices you make to stay at home, to self-isolate, to not go to 6 different stores when you go grocery shopping, to try to go grocery shopping only once a week, to be very careful to keep those 2 meters apart when you go for a walk, if you're allowed to go for a walk. These sorts of things are what will arrest the spread and the increase of this virus. We need all of us to do the best we can to make it through this unprecedented situation, and that's exactly what Canadians are doing. Nous reconnaissons
We recognize that it's important to be open and transparent with Canadians, and that is why we're saying that it might last weeks and even months. Now, obviously, there's several different possible scenarios that we are examining and preparing for. The essential point is the behavior of Canadians. If we make the right choices, if we choose to remain at home as much as possible, if we respect the 2-meter distancing, if we try not to drop in on 8 different grocery stores when we go out to buy groceries once a week, these are choices. And these choices, these behaviors, they will have a direct impact on where we will end up in a couple of weeks and a couple of months. That is why we are here to support families, persons, and businesses. We are there to keep our economy stable while it is almost completely shut down, so that we can restart the engines when that becomes possible. Now, when? Well, we'll only know when we get there, and that depends on the choices we make as persons.
There was a rather startling death projection released in the United States. Is there a similar projection in Canada, and if so, why have we not heard about these sorts of details?
As we've said, there are a range of projections depending on how Canadians are behaving, how isolation is working. I can say right now that the fact that so many Canadians are behaving in the right ways, are choosing to stay home, are choosing to self-isolate, are choosing to stay in their bubble, as Dr. Tam says, are choosing to not endanger themselves or their loved ones or their neighbors or our healthcare workers, is an extremely good sign. We are, of course, watching very, very carefully as the numbers creep up, as they arise more rapidly in different areas, and we will take the measures necessary to do everything we can to keep Canadians safe.
Louis Blouin de Radio-Canada. Monsieur Trudeau, il y a des gens qui sont à la maison.
There are people at home, Mr. Trudeau, and that hear you saying that it might be weeks, it might be months, people that are somewhat anxious facing that uncertainty, and I'd like to have more precise information, maybe a better idea, allow them to plan for the weeks ahead. Can we say to these people that July, for example, is somewhat realistic? We're not sure what will happen, but is it realistic to think of July? Well, it is one realistic scenario. There are others, a shorter time period, a longer time period. We really don't know how we're going to be able to control it. Well, we know how. We should try to control it and control the spread of the virus, but because it doesn't depend on government measures, but rather on the behavior of all citizens, we are preparing analysis of several different possibilities. It might last a few weeks, it might last a few months. We will do what we have to in order to keep Canadians healthy and to ensure that we have the capacity to get out of the crisis by making sure Canadians have the resources necessary to stay isolated as long as it takes. This morning, Mr. Scheer proposed that the GST collected from businesses these last 6 months be paid back to them. What do you think of that idea? Is it a possibility? Well, there's all kinds of ideas put forward by different parties, and we're open to all proposals. We will study them. But what we have proposed so far in terms of aid for businesses and for workers in particular is the biggest measure ever put forward in this country for this unprecedented situation we're going through. It will help workers in businesses. Now, there'll probably be more that can be done. We'll listen. We'll look at other things we could do. I'm always open to suggestion, and I'd like to thank all those who are making proposals, which we will examine to see how we can help Canadians get through this crisis and come out on the other side stronger.
Prime Minister Tom Parry with CBC News. You've been talking about the efforts your government's making to procure medical equipment, protective gear, and yet frontline health workers are still talking about shortages. So why is there this disconnect between the assurances you're offering and what frontline healthcare workers are experiencing?
We recognize the challenges that frontline health workers are facing in different parts of the country. We are working very closely with the provincial authorities in charge of those healthcare systems to try and meet the needs that they're faced with. We are looking at a global demand for these supplies that is unprecedented. Countries around the world are trying to get more of these supplies. We are expecting to see some shipments coming in very shortly that will help in Canada. We're continuing to work on more shipments in the coming weeks. And we are also working on tooling up our own production so that we can have made-in-Canada solutions for the coming weeks and perhaps months if that's how long this lasts. We are doing everything we can to meet the very real and pressing needs that we have in our healthcare system right across the country, particularly in some areas. And all I can say is that we will continue to work extremely hard to try and solve this problem because we need our healthcare systems and our healthcare workers specifically to have the protection they need as they keep the rest of us safe.
The Premier of Quebec was talking yesterday about supplies running out in 3 to 7 days. We've seen shortages in Ontario as well. So have you spoken specifically to those two provinces and offered them aid at this time?
We are offering all the help that we possibly can to all provinces, particularly Ontario and Quebec, that are facing difficult situations in terms of supplies. I can tell you that we are going to be receiving a shipment very soon of necessary equipment, and there are more to come in the coming days and weeks as well. We will continue to do everything we can to make sure that our healthcare workers get the support they need to be able to keep us safe. And we also, as I spoke about yesterday, have manufacturers stepping up so that we can have made-in-Canada solutions and we're not reliant on other countries as the world is looking for more PPE.
Prime Minister Janet Silver, Global News. The scientific literature is fairly clear on how mask use by the public can help cut the spread of influenza during a pandemic. And some countries are now making mask use mandatory across the board. Yet in Canada, the suggestion is that mask use won't really make a difference if you're asymptomatic. I'm wondering how much of a decision is based on the government wanting to make sure the public doesn't take masks away from healthcare workers at a time when there is a shortage.
Yeah, I think every decision we take needs to be based on the recommendations of our best science officials who are looking at everything from protection of Canadians to making sure we're protecting our healthcare workers. And on this issue that I know is an ongoing conversation amongst professionals and health professionals around the world, we are going to defer to our Chief Medical Officer, Dr. Tam.
But with all due respect, Prime Minister, if there are dissenting opinions in the international scientific and medical community on wearing masks for the public, if they are asymptomatics, do we not then owe it to the public to put whatever protective measures in place to protect them?
I'm going to continue to defer to Dr. Tam on this issue. I know there's much discussion going on that, and we certainly want to take the right decisions to make sure that Canadians are protected and that our healthcare workers are protected. Merci beaucoup tout le monde. Bonne journée.
Thank you, everybody. Have a good day.
And that concludes Prime Minister Justin Trudeau's address to the nation, his daily address. Let's bring in Abigail Beeman in Ottawa. Abigail, thank you again. So get a sense, I mean, what did you take from the Prime Minister's address? Some mixed messages when it came to personal protective equipment, no guarantee of access, and then basically saying it's going to come, we will get it, they will be, we're going to make sure that there's no shortage. What do you make of that?
Right. Well, that was a follow-up from yesterday's conversation, really, and we spoke about this before the Prime Minister spoke. He said, you know, we have enough equipment for now, for the foreseeable future. And then about 2 hours later, we heard from Quebec's Premier saying, we're going to run out of some supplies in 3 to 7 days. So the Prime Minister was asked about that a couple of different times. And as you say, not really a clear answer. He's committing to help the provinces that need it. But there's still some answers about just what's going to come and when. I do want to highlight that the most significant part of what you just heard from the Prime Minister is Justin Trudeau saying that he wants to recall Parliament. There were a lot of questions around that. You'll recall that Parliament did sit, or a very condensed group or a smaller group of parliamentarians came back to pass the legislation promising $107 billion of economic relief. Now, these new measures announced, a 75% wage subsidy, is worth a huge amount of money. We're still waiting for details days later, expected to come this afternoon from the Finance Minister, potentially about just how much this will cost. But now Justin Trudeau is saying that he's having his House leader reach out to opposition parties. He wants this to be a team effort in what is the biggest economic relief measures being offered on the table. So parliamentarians expected to come back to pass this new second wage subsidy announcement, separate from that initial $107 billion.
Yeah, so to be continued on that front. Abigail, we'll have to wrap up there. Thank you so much. Let's stay in the nation's capital and bring in Mercedes Stevenson, our Ottawa Bureau Chief. Mercedes, so the other big headline, of course, July is more realistic, and we talked about this being the best case scenario. It sounds like we all have to hunker down for a while, don't we?
Yeah, we do. And that's what I've been hearing from people who are first responders medically, people who are inside the public health structure, both in Ontario and federally. They all say that the modeling they're looking at looks at least 8 to 10 weeks. That's a best case scenario of being inside. So that would take us to July. That fits with what we're seeing from internal documents, the one obtained by the National Post, which showed that they are looking at June 30th, July 1st as being the timeline here. We also have a document that shows that the closure of the border to people coming in from other countries, other than essential workers from the United States or Canadians returning home, would be in place until June 30th. So all of this is consistent. We're talking about multiple sources, multiple media outlets, all getting the same timeline. The Prime Minister himself wouldn't say that. He is saying, get ready for many months, if not weeks, if not months.
Mercedes, thank you so much for all of your insight today, and obviously a lot to unbundle with this story. So let's just sort of break down what we know so far. Prime Minister Trudeau says July, as we heard, is a realistic scenario in terms of when this lockdown could end. A little more clarity from the Prime Minister's office in regards to the wage subsidy program. And the Prime Minister was also asked, and he asked the House Leader to reach out to the opposition to bring back Parliament to make this really a unified effort in terms of addressing and passing this legislation, the wage subsidy. So a lot to get to. We hope to get more information this afternoon. There'll be a press conference with Finance Minister Bill Morneau. Of course, we will cover this extensively on all your local news programs, Global National, and on globalnews.ca. For everyone here at Global News, I'm Anthony Robart. Thank you for watching.
Hi, everyone. Sorry for keeping you waiting. Merci pour patienter.
Thank you for waiting. And hello.
This is a critical week in our fight against the coronavirus. Canadians must continue to practice physical distancing. Please stay strong and stay at home unless you are doing truly essential work, like keeping the shelves of our grocery stores stocked or working on the front lines of our excellent healthcare system. You can go for a walk or a run, but maintain your distance and wash your hands thoroughly when you get home. I know that this is really hard, but I also know that Canadians are resilient and that we can do it. Leaders across the country, including in the province of Quebec and the city of Toronto, have been taking additional measures to enforce physical distancing and to protect their people. These tough actions are absolutely necessary, and I would like to offer my strongest support to the leaders who have taken these actions and to commend them. Il s'agit d'une semaine critique dans notre lutte contre le virus. Les Canadiens et Canadiennes doivent continuer de pratiquer la distanciation physique. Restez forts et restez à la maison, à moins que vous fassiez un travail essentiel comme remplir les étagères à l'épicerie ou fournir des soins de santé. Vous pouvez aller prendre une marche ou aller courir, mais restez loin des autres et lavez-vous les mains. Je sais que c'est difficile, mais les Canadiens et Canadiennes sont résilients et je sais que nous pouvons le faire. Partout au pays, des leaders dans la ville de Toronto et au Québec prend des mesures supplémentaires pour imposer la distanciation physique et pour protéger leurs citoyens. Ces actions difficiles sont absolument nécessaires. C'est du vrai leadership et ils ont mon soutien. So today we are going to hear from Canada's Chief Public Health Officer and her deputy, Dr. Tam and Dr. New. We are going to hear from our Minister of Health, Patty Hajdu. By video link, we are going to hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, et le président du cabinet du Trésor, Jean-Yves Duclos.
The president of the
Dr.
Treasury
Tam,
Board,
please.
Jean-Yves Duclos.
Bonjour, hello everyone.
Hello.
I'll start with my usual update on the number of COVID-19 cases in Canada. So there are now 9,017 cases, including 105 deaths. So in addition, at any point in time, as I've always said, there's many other people under investigation. Some are still waiting for their lab results. Some have not yet been tested. So again, even if you haven't heard of cases in your community, it doesn't mean that there are no cases and there are no exposures potentially there. Just act as though there's illness around you and act accordingly. So we've now completed tests for over 250,000 people in Canada, with around 3.7% of people confirmed as positive and 95% confirmed as negative. I just want to point to our website, which has a lot of epidemiologic information, lots and lots of data. And I'll just spend a moment in clarifying that there is such a thing as an epidemic curve that is posted on our website. And so every day at this point in time, you're hearing the cumulative numbers being reported, so that 9,017 is the total number of cases that we've had ever since the start of the outbreak in Canada. What you don't see with those numbers is when did these people get sick? What is the trajectory of this outbreak look like? And that's what an epidemic curve is, and that is on our website. So if you go there, and as I said before, what you're getting reported today is actually what happened to someone when they got infected and got symptomatic at least 2 weeks ago. So the numbers that you're seeing reported is what happened to someone 2 weeks ago. So you will see that the curve itself goes up and down, and the 2 week delay is, of course, when people get sick, they then have to go and present, they then get tested, they then get the test result, and it takes time for public health to investigate an outbreak, find the contacts, test the contacts. So it's quite an involved process to get you that epidemic curve. So look at it, and you can see what actually is happening, which is also why, when some of the key public health measures were put in a couple of weeks ago, we're not going to see the impact on the epidemic curve of those measures for a little while. But as I've said, this week is a crucial time, particularly in the West, where the epidemic started a little earlier, to see what's happened to that outbreak. And so I'll leave it at that, but obviously it's some of these technical pieces Dr. New and I could unpack for you at any point in time that you wish to ask us questions. So essentially, just to add the epidemic curve, we will not know where the peak of an outbreak is until you've actually passed that peak. That's another concept you need to remember, because this will keep going until you've actually got to the other side. You won't know that you've actually hit that peak. It takes a little bit of lag time. So right now, with the number of cases and outbreaks that we are seeing, they are still connected to a number of high-risk settings in Canada, particularly long-term care facilities. So there's still an urgent need to make sure and double down on precautions. For other high-risk individuals who are living in community settings, it is likewise important to take every precaution, which might mean staying in your home and getting support from others. So while many cases occur in adults, of the younger adults, it is really people over the age of 60 who account for 60% of hospitalizations and 93% of the deaths. So again, the high-risk populations need to take every precaution. And with so many Canadians practicing strict physical distancing, I'm heartened to hear the many stories about how people are staying connected virtually. Across all ages, physical distancing can put a strain on our mental health, with feelings of isolation and loneliness. It is important to remember that while we are keeping physically apart, we are all joined as Canadians in a vital collective effort to preserve health and save lives across our country. So please continue to reach out and find ways to connect and to support others who may be having a particularly difficult time. We all need to keep up physical distancing while maintaining strong social connections. What happens to that epidemic curve is up to every single one of us. Thank you.
Okay, thank you very much, Dr. Tam. Dr. New.
Oui, bonjour tout le monde. À l'heure actuelle, 9017 cas de COVID-19 avaient été déclarés, y compris 105 décès. Par ailleurs, à tout moment, de nombreuses autres personnes font l'objet d'une enquête, attendent des résultats de laboratoire ou n'ont pas encore été contrôlés. Par conséquent, même si aucun cas n'est signalé dans votre collectivité, cela ne veut pas dire qu'il n'y a pas de cas où vous êtes à l'abri de toute exposition. Plus de 250 000 personnes ont été contrôlées au Canada. Environ 3,7% des gens ont reçu un résultat positif, tandis qu'environ 95% des gens ont reçu un résultat négatif. Dr. Tam a donné beaucoup de détails. Moi, je vais essayer de résumer un peu en français. Il y a beaucoup de données sur notre site Web. On vous invite à regarder ce qu'il y a sur notre site Web. Une chose importante, c'est ce qu'on appelle une courbe épidémique. Parce que si on donne toujours les chiffres cumulatifs tous les jours, c'est pas indicatif, c'est quoi la situation actuelle. C'est important de regarder. On peut faire comme des tracés quelque chose graphique pour montrer combien de cas ont été signalés par l'apparition des symptômes chaque jour, tous les jours. C'est important parce que comme ça, on peut regarder, analyser s'il y a vraiment une tendance, c'est quoi le sommet, c'est quoi le pic. À l'heure actuelle, on ne sait pas est-ce qu'on a déjà atteint le sommet et le pic de la courbe épidémique. C'est pourquoi c'est très important que tout le monde continue à pratiquer les mesures comme l'éloignement physique, parce qu'on va voir qu'est-ce qui se passe dans les semaines prochaines. Avec même la courbe épidémique, il y a toujours un délai, parce que même si on reçoit les rapports maintenant, c'est vraiment qu'est-ce qui s'est passé avec l'exposition il y a 2 semaines, 2-3 semaines au moins. Si quelqu'un tombe malade, ça prend du temps peut-être pour voir un médecin, pour chercher des soins de santé, puis après, il y a aussi un dépistage. Il faut attendre aussi pour les résultats des analyses laboratoires. Et finalement, le rapport de santé publique, suivi des contacts, ça prend du temps. Donc, finalement, à l'échelle nationale, on reçoit des données et on sait de mettre ça sur une courbe épidémique. C'est quelque chose à suivre. Alors que de nombreux cas éclosion ont été déclarés dans les milieux à risque élevé au Canada, en particulier dans les établissements de soins de longue durée, nous devons redoubler d'efforts et continuer à prendre des mesures de précaution. Il est également important de prendre toutes les précautions possibles pour les autres personnes à haut risque vivant dans des milieux communautaires, notamment en restant à la maison et en demandant de l'aide aux autres. De nombreux Canadiens appliquent de stricts principes d'éloignement physique et il me fait chaud au cœur d'apprendre comment les gens demeurent en contact de façon virtuelle. Peu importe notre âge, l'éloignement physique peut mettre à rude épreuve notre santé mentale et faire naître un sentiment d'isolement et de solitude. Il est important de se rappeler que même si nous gardons nos distances physiquement, nous sommes tous liés dans cet effort collectif crucial pour protéger notre santé et sauver des vies partout au Canada. Demeurer en contact avec les autres et continuer à trouver des moyens d'aider les gens traversant un moment particulièrement difficile. Nous devons tous continuer à appliquer des principes d'éloignement physique tout en maintenant de solides liens sociaux. Thank you, merci.
Okay, merci beaucoup, Dr. New. Now we will hear from our Minister of Health, Patty Hajdu. Patty, please.
Well, hello. Commencer à remercier tous ceux et celles qui font le part de la réponse au COVID-19. Je sais que c'est difficile, mais nous ne pouvons pas nous arrêter maintenant. Vous êtes la première ligne de défense contre ces virus et notre gouvernement essaie de faciliter un peu les choses. Yesterday, we launched a new mobile app to help Canadians stay informed. The Canada COVID-19 app is available for free from the Canada.ca website, as well as both the Google and Apple app stores. This app will provide up-to-date information about the COVID-19 pandemic in Canada, including advice for preventing the spread of the virus, important contact information, and guidance for seeking medical help. And it includes a way for Canadians to check their symptoms on using the app. This app is just one more way that we can give Canadians information that they are seeking during this outbreak. We're going to continue to reach out to Canadians in any way possible so that we can work together to flatten the curve. And in the days to come, I will also announce a mental health digital toolkit that will help Canadians with the significant increase in distress that many of us are feeling in this uncertain time. I also want to reiterate the message that Dr. Tam has been sharing with Canadians. The number of COVID-19 cases being reported daily does not paint a full picture of what is happening across our country. It's important to remember that many people in all parts of the country are currently waiting on lab results, or they simply haven't been tested. So if you are not hearing about cases in your community, it doesn't mean that they don't exist. And for that reason, people must stay the course and practice social and physical distancing and follow the local and national public health advice no matter where you are or no matter how many cases there are or aren't in your community. I know this is very hard, but I'm confident that if we continue to work for the common good, we can and we will weather this storm. Now, the important thing to remember is also to remain kind to one another. This time is difficult for everyone. This is the time to reach out safely. Call your loved ones. Write a letter to a friend. Volunteer safely to help those who are needing support. Our government will continue to work hard to have your back, but you, each and every one of you, can make a difference today in how someone is feeling. We must meet our fear together with courage. It will take courage to act with compassion. But it is by meeting fear with courage and compassion that we will get through this together and come out stronger on the other side. Thank you.
Okay. Thank you very much, Patty. Now we are going to hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, and she is joining us by video link. Carla, please.
Hello, bonjour. I'm pleased to be able to join you and my Cabinet colleagues today via video conference to give you an update on the Canada Emergency Response Benefit that was announced last week. Au cours des 2 dernières semaines, nous avons connu une vague sans précédent de demandes de prestations d'assurance emploi, un total de 2,13 millions à l'heure actuelle. Pour mettre les choses en perspective, en 2018-2019, il y a eu au total 2,1 millions de personnes qui ont reçu de l'assurance emploi for l'année entière. To address this, we have redeployed staff, brought back people from retirement, and redesigned our systems. As I said last week, the reality is that our EI system wasn't designed to address a global public health crisis and its significant economic impacts. It doesn't cover all types of workers, particularly those with irregular hours and lower pay, often filled by Canada's most vulnerable populations, including persons with disabilities, youth, and new Canadians. Since the beginning, we've been unequivocal in our commitment to supporting all workers facing hardship as a result of the COVID-19 pandemic. That's why we announced the Canada Emergency Response Benefit. As we've developed our plans, our priority has been to ensure that Canadians can access this benefit in the simplest and fastest way possible. Today, we're pleased to let Canadians know that more information on how to apply for the CERB is now available online at canada.ca/coronavirus-CERB. And as of next Monday, April 6th, Canadians will be able to apply for the CERB. The CERB is being jointly administered by Service Canada and the Canada Revenue Agency, which will leverage the Government of Canada's 2 largest payment systems, allowing for more timely and accurate delivery of this important emergency benefit. Direct deposit payments will be made within 3 to 5 days of applying, with checks taking approximately 10 days. Cette page web sera mise à jour et servira de page principale de demande pour cette prestation d'urgence, avec une option pour les Canadiens qui n'ont pas accès à l'Internet ou à un ordinateur de faire une demande par téléphone avec Service Canada. Nous encourageons tous ceux qui pourraient être admissibles à se préparer avant lundi prochain en ouvrant leur compte Service Canada ou de l'Agence de revenus du Canada en ligne. They should also make sure that they can get direct deposit in order to receive the benefit faster. For Canadians who have already applied for EI, there's no need to reapply. These applications will be automatically enrolled in the CERB. As I mentioned earlier, we've received over 2.1 million EI claims over the past 2 weeks, with more coming in each day. As of today, we've processed more than 430,000 of those claims. I'm pleased to report that in a space of a few weeks, Service Canada has developed and implemented a streamlined process that, starting today, will be able automatically to process approximately 400,000 applications per day. This means that the backlog of COVID-19 related applications will be addressed within the next week. This also means that some Canadians who have already applied through EI will begin receiving their CERB payment over the course of the next few days. Les employés de la fonction publique travaillent fort pour offrir aux Canadiens le soutien important dont ils ont besoin en ce temps difficile. J'aimerais profiter de l'occasion pour les remercier de leur dévouement. We'll continue to work together to find ways to support Canadian workers and their families. Merci, thank you.
Okay, thank you very much, Carla, and I am relieved the technology actually worked. Maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos.
Merci, Christia, et bonjour tout le monde, et merci de vous joindre à nous aujourd'hui. Comme vous le savez, la pandémie de la COVID-19 représente une urgence sanitaire, économique et sociale. Et dans des circonstances aussi historiques, notre gouvernement a aussi choisi de prendre des mesures historiques afin de protéger la santé et la sécurité de tous et de toutes. En plus des mesures de santé publique que nous connaissons déjà bien, nous avons voulu nous assurer que tous les travailleurs affectés par cette crise puissent rapidement avoir accès à l'aide financière dont ils ont besoin pour traverser cette période difficile, notamment par la mise en place de la nouvelle prestation canadienne d'urgence. Notre but est de faire en sorte que cet argent soit rapidement disponible et que les Canadiens puissent y accéder le plus simplement possible. Les mots-clés sont rapidité, facilité, simplicité et ne laisser personne de côté. We know that it is important to get money into the hands of Canadians right away, whether they are not working because they are sick, have been laid off, have lost their income, or are looking after their children. Grâce à la prestation d'urgence du Canada, les travailleurs salariés et les travailleurs autonomes admissibles recevront un montant de 2 000 toutes les 4 semaines pendant un maximum de 4 mois. La mise en place de la prestation d'urgence du Canada dans un délai aussi court est un exercice unique dans l'histoire de notre pays. 2 organisations gouvernementales, l'Agence de revenus du Canada et Emploi et développement social Canada, travaillent ensemble très fort pour offrir conjointement la prestation canadienne d'urgence. Through the web page that will be launched today, Canadians will be directed towards a service option that best fits their circumstances. The address is canada.ca/coronavirus-CERB. It is the same page for everyone. Demands will be accepted starting on April the 6th. La page web canada.ca/PCU-coronavirus sera lancée aujourd'hui pour faire une demande d'ici à partir du 6 avril. Les demandes de prestation canadienne d'urgence sont effectivement disponibles à partir du 6 avril, même si le site est lancé aujourd'hui. En raison du grand nombre de demandes anticipées, nous demanderons aux Canadiens de faire leur demande sur une période de 4 jours, dépendamment de leur mois de naissance. C'est-à-dire le 6 avril pour ceux qui sont nés en janvier, février et en mars, le 7 avril pour ceux qui sont nés en avril, en mai et en juin, le 8 avril pour ceux qui sont nés en juillet, août et septembre, et le 9 avril pour ceux qui sont nés en octobre, novembre et décembre. Cela n'aura aucune incidence ou bien sur le montant de la prestation ou sur le début de la prestation. Le versement des prestations aux Canadiens est l'activité principale de l'Agence de revenus du Canada et l'Agence de revenus du Canada versera la prestation canadienne d'urgence de manière en profitant d'un système solide ainsi que d'un personnel dévoué, comme c'est déjà le cas par exemple pour la livraison à 6 millions de familles à chaque mois de l'allocation canadienne pour enfants. Notre gouvernement s'est engagé à soutenir les Canadiens et les entreprises, mais il est essentiel que cette information soit la plus largement diffusée. Et c'est pour ça qu'en terminant, nous aimerions remercier chaleureusement et souligner le travail des journalistes et des médias pour transmettre ces informations importantes aux Canadiens. Les sacrifices exigés de chacun et de chacune sont importants, mais ensemble, nous allons traverser cette crise en gardant confiance et en continuant de prendre soin les uns des autres. Merci. Thank you.
Hey, merci Jean-Yves et on est prêt à répondre à vos questions.
Thank you, Jean-Yves, and we're now ready to
so as usual,
questions.
one question, one follow-up. We'll take 3 questions on the phone and come back to the room. Operator?
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1 sur votre clavier. First question is from Alex Ballingal from Toronto Star. Please go ahead. Votre ligne est ouverte.
Hi, thanks so much for taking my question. I'm not sure, this one might be for Minister Hajdu and Dr. Tam. This morning, the Prime Minister was talking about a range of scenarios going forward with number of infections, I assume number of fatalities, length of time we could be existing under these social isolation and social physical distancing measures. I'm wondering if you guys can give us a sense of that range. What is the best case scenario in actual numbers of infections and fatalities and length of time, and what is the worst case scenario in those three things?
I'll start, Alex. Thanks for the question, and then I'll turn over to Dr. Tam for some specifics. That's the work we're doing right now, is some modeling work in terms of what we could anticipate given various measures that have been taken across the country by various provinces and local municipalities, as well as federal government actions. It's not as easy of an answer as I think it would seem, in that different ranges can be anticipated in different ways depending on the measures that have been taken, the effectiveness of those measures, when they've been taken, etc. So I'll tell all that to say that that is top of mind for us in terms of what we're doing at Health, because not only does it give us a way to accurately or more accurately predict what kind of surge we might see in different parts of the country, essentially important in terms of how we use our physical and human resources, but also what kinds of patterns of disease we might be anticipating given the different measures. Alleviating measures impact our ability to control that curve or reduce the severity of future surges or future waves. So as much as I wish I could just give you a simple answer, there isn't one, but I will tell you that a lot of work is being done on that. I don't know if Dr. Tam has more that you want to add.
I think that's a good explanation, and really, together with the other chief medical officers, we've been looking at planning different scenarios, but all of us recognize that right now, how you influence the trajectory of this pandemic absolutely is dependent on exactly what we're doing right now. So it's to act rapidly. Even when we don't have all the information, we must act as we are doing now. In some respects, as we strengthen our public health measures over the last weeks, it also took a little bit of time for Canadians to truly pick up this message about physical distancing. So a lot of these measures were taken, just ahead of this, and so we really want to make a massive effort, because the length of time you could be into this epidemic wave is all dependent on what we're doing right now. So and scenario planning is actually quite simple on a piece of paper, because all you have to do is do a set of attack rates at the top, mild, moderate, severe on the other side, and give you a number. Is not that helpful for us right now. But we have been doing that exercise, and but we really want to focus our attention on getting this first wave under control. Let's just say that, just to add that, any planning scenario has us potentially overwhelming our healthcare system. So as I've said, part of the exercise so that you free up some of the hospital resources and ICUs, purchasing extra ventilators. But the really difficult message, I think, to Canadians is that on a whole range of these scenarios, this health system isn't well designed to cope with it if we don't do something about it now. So it doesn't matter which number you plug in, that's the truth of the matter. It is an extremely serious situation. You've seen how this has played out in certain areas of the United States. None of those scenarios are a good one. You've got to do something about it now.
Thank you, Dr. Alex. Follow up?
I just want to make sure I understand what you're saying. You're saying that in the range of scenarios, none of them are good, as in we're looking at a surge that could test the capacity of our healthcare systems no matter what?
Absolutely. That is the bottom line. Everyone's trying really hard, as I say, to move the health system resources so that you can cope with what it might be an upcoming upsurge of patients. People have looked at alternative care sites, absolutely trying to expand the current health system, the health workforce, in order to cope with this. So I do believe the health capacity, compared to what your regular day might be before this pandemic, has been freed up quite a bit. But still, even if you looked at some of the lower attack rates, it is not something that we want to see. So public health on the other side is trying to suppress the curve while the healthcare system is trying to increase its capacity. So I think if we can suppress this initial curve, we believe the health system right now is coping. So when we're looking at the fatality rate at the moment, we know that is an unstable number because some people are still in a very critical condition. But the percentage of fatality is hovering around that 1% in some areas where you hit a particular geographic location where there's a lot of people in long-term care facility, you get a higher case fatality rate. But the health system is actually coping quite well at the moment. But any of those bigger projections, when we look at the worst case scenarios, your health system will not be able to cope. It's about now doing really fast. But it is fundamentally, in the end, some very difficult decisions may have to be made about the prioritization of existing resources. So that's some of the really critical work that's being done in the health system right now.
And Alex, I'll just end by saying that health systems were never designed for this kind of surge. And so that is the challenge. And I think if Canadians can take anything away from what Dr. Tam has said, it's something that she said over and over and over, that our individual actions is the strongest tool we have to protect our healthcare system. Because this is a sneaky virus. We may feel very mildly ill. Some people don't feel ill at all. And that is why the social distancing and the physical distancing is so critically important, because an assumption that you're well and therefore are not posing a risk to somebody at the grocery store or posing a risk to your neighbors while you have a drink on the patio as things warm up is the wrong assumption to make. We have to all act as if we are carrying this virus. And that doesn't mean that you can't go for a walk, but it means that you do keep 6 feet of distance between yourselves and the other person next to you on the sidewalk or in the grocery store, and that you limit your socialization to the members of your household. This is a really hard message for many, many Canadians, and I know that. And I know there are circumstances out there that are very difficult. But ultimately, at the end of the day, our neighbor's life depends on us taking this seriously, because ultimately, at the end of the day, our health system cannot cope with the surge. It was never designed to see that many critical patients all at once, nor would any system around the world be designed, as we have seen from countries all around the world try to get ready for this surge. And so Canadians play a very important role in keeping their neighbor, their loved one, their relative alive.
Thank you, Minister. Opératrice, prochaine question.
Thank you. Merci. The next question is from Hélène Buzetti, Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. Ma question est pour le ministre Duclos. J'aimerais que vous nous expliquiez plus en détail la différence qui existe entre la subvention du salaire à 75 % et la prestation d'urgence de 500 $ par semaine. J'ai calculé que dès lors que vous gagnez 35 000 $ par année, ou à peu près 675 $ par semaine, la subvention de 75 % de votre salaire est plus avantageuse. Alors si, comme votre gouvernement semble dire, dans les deux cas, vous préservez votre lien d'emploi avec votre employeur et que dans les deux cas, vous n'êtes pas obligé d'aller au travail pour la recevoir, quel avantage aurait un travailleur donc qui gagne plus que 35 000 $ de demander la prestation d'urgence alors qu'il pourrait s'arranger avec son employeur pour plutôt demander la subvention?
Merci pour la question. Il y a deux objectifs totalement importants et c'est dans la philosophie suivante. suffisante. On veut absolument que les liens d'emploi se maintiennent dans la mesure du possible entre les employeurs et les employés, non seulement parce que ça permet de garder les relations qui peuvent être très importantes à court terme s'il y a des retours au travail progressifs et épisodiques, mais surtout dans la perspective où il faudra un jour relancer l'économie et ça va être plus facile si les liens d'emploi sont maintenus. Maintenant, dans cette philosophie générale, il y a donc deux objectifs. Le premier est atteint à la fois effectivement par la prestation canadienne d'urgence et par les subventions salariales qui sont annoncées et qui sont précisées encore davantage aujourd'hui. Donc, de faire en sorte que, peu importe que l'entreprise soit capable ou non de payer des salaires au cours des prochaines semaines, qu'il y a un plancher de 2 000 $ qui soit disponible pour tous les travailleurs. Mais la deuxième chose, c'est que dans beaucoup de cas, on s'attend à ce que des entreprises veulent continuer de verser des salaires aux travailleurs pour les aider à joindre les deux bouts au-delà du 2 000 $ de la prestation canadienne d'urgence. Et c'est là que la subvention de 75 % du gouvernement canadien intervient. Et le ministre Morneau et la ministre Eng ainsi que le ministre Baines vont très prochainement donner davantage de précisions sur comment cette subvention salariale va s'appliquer.
My question would be for Minister Hajdu. It's regarding the stockpile. We hear that Quebec is almost facing a shortage of masks. So I just would like to know how many in the stockpiles can be sent right away to Quebec, and how much, what percentage of the total overall stockpile does that represent, and when will that be sent?
Thank you. I don't have the numbers for you in terms of percentages and total numbers in the stockpile, but I will tell you that there is a deputy minister table working right now on an allocation that is based on actual need. We know that all hospitals are in need of personal protective equipment, and the provinces and territories are working with the federal government to develop an allocation process that really gets at making sure those products are going to the areas in the country that are experiencing the surges right now, so that we can do this in an equitable way and in a fair way that makes sure that Canadians and the healthcare workers that are serving those Canadians have their needs met in a way that's going to actually make sense. This is difficult work, as you can imagine. Every province and territory is working to build up their own stockpiles for what may come in the days and weeks to follow, but I have confidence in our officials that the process that they're working on with ministers of territories and provinces is a fair one. I spoke to all of my colleagues last night on our weekly FPT call, and that work continues.
Et si je peux, je veux ajouter que la ministre en Inde a annoncé hier que le fédéral a commencé à acheter 60 000 de masques. Aujourd'hui, on a ajouté 5 000 masques. Comme le ministre Hajdu a dit, le ministre Hajdu est en étroite collaboration avec tous ses homologues dans toutes les provinces. Nous comprenons que la situation au Québec est particulièrement difficile maintenant. Hier soir, j'ai parlé avec la ministre Sonia Lebel et nous avons discuté la situation.
Thank you, Deputy Prime Minister. Last question on the phone before we turn to the room.
Thank you. Merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead. Votre ligne est ouverte.
Hi, my question is also about the stockpile. I know we've been asking this question a lot, and I just don't think we've got an actual answer. How big is the stockpile? And if we have a stockpile, why are we hearing from doctors, from nurses on the front lines that they do not have enough? Did we not have enough in the stockpile? Have we not started distributing anything from it?
I don't have the exact numbers because the numbers change, as you can imagine, day to day as we dispense equipment across the country. To your question about whether we had enough, no, we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness, and I would say that obviously governments all across the world are in the same exact situation. It is an extremely competitive space right now. now for personal protective equipment. We are pulling out all of the stops, as you have heard from our Prime Minister, from the Minister of Procurement, from the Deputy Prime Minister. We are working, I would say, 24 hours around the clock trying to procure equipment in a global situation where equipment is extremely tight. I have heard those stories myself from frontline workers. I know provinces and territories are developing different sets of rules for frontline workers around the disbursement and use of personal protective equipment, but I will tell you that we will not stop this work to get the PPE that we need. And I would say that this is an opportunity for all governments to consider reinvesting in public health and preparedness, and I look forward to those conversations on the other end of this. But I will tell you that the situation right now is such that our government has the money, we have the will, we have the workforce, and everybody's focus is firmly on getting PPE, and we will continue to fight for Canada's shares in that available stock as it comes online. Secondly, I'll say that the work on domestic production is incredibly important, and I am very, very, I feel very, I would say, I feel very warmed by the effort of Canadian companies that have reached out to me personally. I know reached out to many other members of Parliament, many other ministers about their efforts to retool. The reason why it took so long to find that word is just there's a feeling of warmth when I think about the effort of Canadian companies that are putting everything into trying to turn their manufacturing processes around as quickly as possible to create the things that Canadian frontline workers need. And we're going to continue to support them. The work that we're doing on making sure that we can accelerate regulatory processes, for example, to get these products created, to make sure that they meet the specifications that healthcare workers need, that frontline workers need. This is all work that's happening literally around the clock, and I'm incredibly proud of my colleagues who are working so hard on this. So thank you for the question.
Thank you, Minister. Next, we'll turn to the room now, starting with Julie, CBC.
Van Dusen, CBC. Just wondering, it could be for Ms. Freeland or Ms. Qualtrough. Could you explain to Canadians in a really simple way, the House of Commons was here last week to pass a benefits package. Why do you have to come back? Is there a problem? What has to be fixed? And is it going to delay people getting the money they urgently need?
Why don't I begin there? Because the Prime Minister, as he said today, has asked me and the House Leader and Jean-Yves to work with the opposition about a return of the House. This is really because we understand and value and respect the role of the opposition in our parliamentary democracy. It is so important for Parliament to play its role, to have its voice. We have seen that as we have been doing our work to get the support to Canadians they need, our work on procurement, our work on supporting Canadians as the economy is feeling the impacts of the coronavirus. And the Prime Minister has judged, and I 100% agree with him, that the magnitude of the measures that we know are necessary means that it would be a good idea to bring Parliament back to work on them. And I would also like to say we are very much hoping and trusting, and I really believe that the opposition in the House will work with us in the spirit in which we are working on these issues, which is understanding that now is not a time for partisanship. Now is a time for a true Team Canada effort as we collectively rise to a challenge which can only be compared to the national challenge we faced in the Second World War.
Question. You didn't say why you're coming back, what needs to be fixed, will it delay the payments?
I think I did, Julie. I said that the Prime Minister believes, and I agree with him, that it is right and proper for us to be consulting with Parliament and working with Parliament given the magnitude of our measures. And you have heard from Carla and from Jean-Yves our plan to urgently get the payments out to Canadians because Canadians need them desperately, and we get that.
No delay. Second question is for Dr. Tam. Thank you. It's a kind of a double whammy. Do you have enough tracking methods to track? And also, with this surge coming, apparently, how are doctors going to decide who gets a ventilator? Are there guidelines, and what are they?
So I think
contact tracers. Do you have enough? And what about the ventilators?
Contact tracing. Okay, got it. So one of the absolutely most important thing to get this first wave under control is not just case detection, but contact tracing. So that is a massive topic and amongst the chief medical officers. So I've been having these discussions very intensely to make sure that there's enough capacity, public health capacity, to do the contact tracing. So the majority of jurisdictions actually have for now, but a few have said, look, if the cases go up in the next couple of weeks, we're going to need some help. So what we've done is at the federal level, we'll be providing that kind of support as needed by recruiting students and other human resource in order to provide that support to the provinces. Many of them have actually done a lot of this preparation already. They've recruited medical students, they've recruited other retired health professionals. Alberta has a good training module already done to get people trained on contact tracing. And many people have come up to say that they can help with that. So, but that is such an important question. And if anybody needs any help, we're here to provide that surge capacity. So that's one. And in terms of the second question, could you just remind me?
Ventilators, how do you?
Okay.
Doctors are going to have to make some difficult decisions. You were mentioning that a little earlier. So who gets a ventilator? Who doesn't? What guidelines are they being given?
Yes, so there are existing guidelines, and certainly in pandemic planning, we have ethical frameworks that we previously looked at. What I can tell you is that in different jurisdictions, they actually have guidance on how to prioritize. It's a very, very difficult decision in terms of making those decisions. So you will, if you reach out to Ontario, for example, their hospitals, their intensive care specialists, their ethicists, and others have come together to provide those difficult guidelines, and they are well laid out so that people are ready to potentially have to make those decisions.
Thank you, Doctor. Just a friendly
Some
reminder.
of those factors and underlying medical conditions, and there's a whole host of considerations. Yes.
Thank you, Doctor. So just a friendly reminder, one question, one follow-up. A clarification is a follow-up. Be mindful. Thank you. Mike, Global.
Why, hello. So scientific research or literature is clear on that masks could reduce the pandemic. But and we're suggesting to the public here in Canada that we don't give them these masks, we keep them away from them. Is this because we are prioritizing the healthcare system and the shortages there? Or what other reason would it be that we wouldn't want the public to go out and have these masks?
So I'll start, and then I'll turn to Dr. Tam. I think, first of all, the premise that the science is clear is not accurate, but I think there are obviously growing thoughts around the use of masks for general public wearing. Certainly, Dr. Tam's been keeping her eye on that science and giving us advice in terms of our own messaging. But yes, it's absolutely critical that if people are wearing masks outside, and it certainly is their prerogative to do that, by the way, that we're not taking away masks that are surgical or specialized that are extremely necessary on the front line, and that we're not using masks in a way also that are not appropriate. So, for example, most people don't realize, most general public doesn't realize that N95 masks just put on don't necessarily provide a greater level of protection. They have to be fit tested, which is a long process that I won't describe right now. But ultimately, at the end of the day, an N95 doesn't provide you additional protection if you're not using it properly. Dr. Tam has also been really clear that when we put face masks on and off, that we can unwittingly infect ourselves, or we could have a false sense of security that we have a mask and therefore be touching our face more and all kinds of things. So that's to say, all that to say that it is a personal choice. And if people feel that they want to make a cloth mask and wear a cloth mask, that is perfectly within their purview, and it wouldn't be up to me to determine that they shouldn't. But we do need to protect medical masks for medical professionals and other frontline workers who need them in the course of their everyday duties. And so that's the Minister of Health's perspective. I'll see if Dr. Tam has an additional comment.
Yes, I think the number one sort of concern of the health system is that the supply of medical masks, respirators must be preserved for health workers, those who are looking after patients. So that is probably the number one reason for making sure that the public understands that. We also know what actually does work already, which is physical distancing. Those droplets fall a certain distance. That's why we've been recommending the 2-meter distance. That actually works. Frequent hand washing absolutely works. Not touching your face are absolutely proven measures, and everyone should practice those regardless of what else you're adding to those layers of protection. And so then the use of what one might call non-medical mask or other materials. I think I got asked this question maybe a couple of days ago by asymptomatic people just going about in the community. On the one hand, might potentially reduce you from touching your nose and your mouth. Like if you covered off those parts, but you have to be really careful you're not then putting your finger in your eye, or when you're pulling your mask on and off, that you're touching your face in other ways. So that is one aspect of it. I actually do sort of, if you had a fabric or homemade mask, it's a way of covering your cough. We've always said you should cover your cough so that you're not throwing your droplets around to someone else or on a surface, for example. So it's a way of protecting others in a way. When we go, if you didn't have a tissue, you cough into your elbow, a mask kind of acts as that kind of a barrier, if you want to think of it that way. The effectiveness of the use of non-medical masks hasn't really been well demonstrated, but I think that there may not be any harm in wearing it, as the minister said, if one uses it properly. It's not gaping, it's fairly well fitted, and you really practice good hygienic measures before and taking them. You have to wash your hands. But I would say that absolutely, no matter what you do with that kind of a covering of your nose and mouth, you have to practice what we know works, which is that physical distancing, hand washing, and not touching your face. So I think I've always said that, from a public health perspective, we need to take in evolution in information and science, and we've been doing that. And these are the kind of things that we discuss as a community of practice in terms of the public health and the chief medical officers.
I think you mentioned this the other day, but just to clarify, when would someone in the public, because of the shortages, would you recommend that they have a mask or something?
So certainly, if you are a group of persons who actually have the illness, so you have COVID-19, you've been asked to self-isolate because you may have been exposed, and then you need to actually get yourself someplace to the actual clinic or where you're directed to go for essential appointments or other places, then is covering up your cough, covering your mouth. Sometimes maybe your symptoms might be very mild. You may not know whether you're developing or not. Under those circumstances, covering your mouth does prevent your droplets from being transmitted to others. So still, it's people who are symptomatic who may have the illness, but we do recognize that sometimes people have very mild illness, or that they may not even recognize they're beginning to develop the illness. So people in the incubation period.
Thank you, Dr. CTV.
Ian Wood, CTV News.
Minister Freeland, rent was due today for many Canadians, and many Canadians probably couldn't make their rent. While the government's going to provide $2,000 a month, that check is not coming for days still. And even when it does come, in many cities, $2,000 a month isn't enough for rent. And while it might be a provincial, municipal jurisdiction, why hasn't the government stepped in at this point where it's helped homeowners, but it's not helped renters?
So that is a really good question, and it's something that we are very preoccupied by and focused on, both inside our own government and in our conversations with the provinces, many of which have taken real action on this front. And I do want to be clear that in this crisis, we are never going to quibble about what is a provincial responsibility and what is a federal responsibility. We believe and understand that the federal government has a responsibility to all Canadians and that the federal government has to provide leadership to the country. This is a really big economic challenge. And it is a huge health challenge. And so the way we have structured our work is to start with the health and safety of Canadians, to begin literally with the life and death issue. And that is 100% the right thing to do. And that is overwhelmingly the center of our work. Next has come an effort to do everything we can to help Canadians weather this economic storm and to ensure our society, our economy are able to come roaring back when the crisis is over. And we started in exactly the right place, which is doing what we could as quickly as we could to support individual Canadians, and that is what we have been hearing about from Carla and Jean-Yves today. The CERB $2,000 a month for people who can't work because of coronavirus or who have lost their jobs because of coronavirus. The Prime Minister announced just last Friday another huge step, which is the wage-subsidy program. This is the biggest economic program the Government of Canada has ever put into place. I want Canadians to really understand the magnitude of it. And that program is focused on keeping companies afloat and maintaining that essential connection between employers and workers. So important so that we can go back to work when this is over, and so important psychologically for people. And that was a huge, huge thing. Exactly the right thing to do next. The third thing, which we have done already, is provide huge liquidity support to banks and to the banking system. Also extremely important, and I really want, and that has been the work of our government and of the Bank of Canada. That is in place. Have we done everything that needs to be done? Absolutely not. Are there outstanding issues? 100%. Are we focused on them? Absolutely. When it comes to the specific question of rent checks being due, in addition to some concrete measures that we have seen taken by provinces and cities, which I commend, let me just also say to all of the landlords across the country, you have a responsibility too. In some places, eviction is not being permitted during this crisis, but whether or not that applies to you specifically, we are all in this together, and it would be a heartless act indeed to evict someone right now, given what we are all going through. Now, it is the case that for some landlords, they need to make mortgage payments, and they rely on rent to make those payments. And again, there we have been working with the banks and have taken some concrete steps to give people some breathing room.
Quebec today announced that they're going to put in checkpoints at interprovincial borders, including the ones that are not 5 minutes walk from here into Gatineau. Time and time again, we've been told with regard to measures, whether they be closing the U.S. border or closing restaurants or whatever that might be that we're now doing, that when we've asked about them, we're not quite there yet. And then we have gotten to that point. Like Gretzky says, you go to where the puck is going to be and not where it is. So is this the time now, with Quebec closing it, or not closing, but putting in checkpoints, is this the time now for the federal government to start limiting domestic travel?
Ian, you anticipated the metaphor I was going to use. I think, well, look, I grew up in northern Alberta, so I am 100% a Wayne Gretzky fan, and that notion of skating to where the puck is going to be has actually been a guiding principle for our government. Quebec has taken some strong measures today. The province of Quebec has our support and admiration for showing real leadership there, as does the City of Toronto, which introduced some very significant measures today. Those are exactly the right things for Canada's biggest city. And again, I would like to really commend the leadership that John Tory and Dr. Eileen de Villa have shown. We have heard some very sobering messages from Dr. Tam and from Patty this morning. This is very serious. It will get worse before it gets better. And we can all do something about it. And what we can do is to maintain physical distancing. Governments can help people to do that by introducing these tough measures. But at the end of the day, every single one of us can make a difference. And I hope and believe and trust that that is what Canadians are doing. As to whether further measures are being contemplated, of course they are. Everything is on the table.
I'll just add to that. Different jurisdictions are going to take different measures based on their own epidemiology and their own realities. And obviously, that is well within their jurisdiction to do that. But I will also say that where we know at the federal level we need to redouble our efforts to actually bring down the number of cases across Canada are on the things that Julie was asking about, contact tracing being one of them, which is why we're mobilizing hundreds and hundreds of people across the country to support provinces with that very onerous task. Some of those people are being deployed in Ontario right now who has put up their hand to ask for help, and we would encourage other provinces who need that support to reach out, because we will be increasingly having numbers to provide them of bodies and people that can help them with that work. Secondly, isolating people who are symptomatic. So we're working very diligently with provinces and territories on making sure that they have the capacity to isolate people who are ill, even mildly so. In some cases, people do have family homes in which they can isolate. In other cases, people do not. And so the work that's happening right now at the provinces and territories level is to find alternative accommodations to isolate people who may not have the ability to do that safely in a private residence. That will go a long way in reducing cases. So while provinces and territories, and indeed the federal government, take a variety of different measures to help prevent close contact of people and increased mobility that we know in some cases puts additional strain on systems, I think the practical steps of really doubling down on some of the recommendations of the World Health Organization are increasingly important. And that's where I, as the Minister of Health, have my attention focused on, is the practical things that can help provinces and territories right now understand who is ill, who they've had contact with, and how we ensure the isolation of those particular people who have come into close contact with the virus.
Thank you, Minister. We'll take 3 last questions on the phone and call it a day. Operator.
Thank you. Merci. The next question is from Philippe Vincent Foisy de Radio-Canada. Please go ahead. Votre ligne est ouverte.
Oui, bonjour, Dr Tam. Monsieur Duclos, peut-être que vous allez pouvoir répondre aussi à ça. Là, il y a eu des choses qui sont dites en anglais sur une possible pénurie de matériel médical et aussi sur les systèmes de santé qui ne sont pas du tout prêts pour une hausse considérable des cas. Est-ce que c'est bien ça que vous avez dit, Dr Tam?
Merci pour la question. C'est Dr. New. Si je comprends bien la question, c'est toujours ce qu'on dit un enjeu actuel, le potentiel pour pénurie de l'équipement de protection individuelle. Comme la ministre Haidou a déjà constaté, on travaille étroitement à toutes les échelles du gouvernement, aussi à l'échelle technique de Dr. Tam et moi avec nos homologues. On travaille pour chercher l'équipement partout dans le monde. C'est vraiment très compétitif dans le marché mondial, mais en même temps, on est toujours aussi visé pour augmenter la capacité domestique pour fabriquer l'équipement essentiel ici. Si on parle des systèmes de soins de santé, comme on a déjà constaté plusieurs fois, le but maintenant, c'est comme dit aplatir la courbe. Parce que si on continue avec la modélisation, si on ne fait rien, on peut avoir un désastre. On peut avoir peut-être 30, 50, 70% de la population contaminée, beaucoup de personnes qui ont besoin de soins de santé intensifs. C'est ça qu'on veut éviter. C'est pourquoi les mesures comme éloignement physiquement, c'est vraiment critique. Si on continue comme toute la population, comme tous les Canadiens et Canadiennes, c'est ça les mesures nécessaires pour aplatir la courbe. Parce que si on parle des hôpitaux avec des soins de santé intensifs. Si on parle hypothétiquement, peut-être qu'on peut avoir, avec la pandémie, peut-être 1000 personnes qui ont besoin d'un respirateur artificiel. Mais il y a une différence si on demande les 1000 personnes tout d'un coup dans une semaine, ou on peut, comme on dit, avoir les 1000 personnes qui ont besoin d'un ventilateur, un respirateur artificiel pendant plusieurs semaines ou plusieurs mois. Ça, c'est le but. Et comme Dr. Tam aussi constaté, on planifie aussi tous les professionnels, aussi les autorités sanitaires à toutes les provinces, dans toutes les provinces et territoires pour se préparer. On parle maintenant d'avoir les hôpitaux, comme dit, temporaires de campagne. Aussi, on rappelle peut-être même les médecins, les autres professionnels déjà à la retraite pour peut-être aider dans le système de soins de santé. On planifie aussi peut-être les personnes avec des autres conditions. Est-ce qu'il y a des autres façons de gérer peut-être pas dans les hôpitaux? Donc, toutes les échelles, on travaille étroitement pour, comme on dit, éviter le pire scénario.
Mais quand vous regardez vos modélisations, vos modèles, les possibilités, les prévisions, on peut en avoir jusqu'à quand? Ce matin, le premier ministre disait jusqu'en juillet, c'est réaliste, mais ça peut être bien pire aussi. Est-ce que vous, dans les prédictions et les prévisions que vous faites à l'Agence de la santé publique, c'est ça que vous voyez aussi, on en a au minimum jusqu'à l'été?
C'est trop tôt. Comme on voit maintenant, les mesures, c'est déjà mis en place que les mesures on voit que tous les Canadiens prennent ça pour sérieux. Et tout le monde pratique maintenant. On voit beaucoup de monde pratique les mesures d'éloignement physique. Et ce qu'on a vu déjà avec la courbe épidémique, les cas, on voit maintenant actuellement, sont déjà les cas qui se sont exposés il y a peut-être 2-3 semaines. Donc, il faut voir qu'est-ce qui va se passer dans les semaines prochaines pour voir si les mesures que tout le monde pratique maintenant vont porter des fruits. Ce que je veux dire. Donc, c'est ça à regarder. Et c'est trop difficile pour prévoir qu'est-ce qui va se passer dans 2-3 mois. Je pense que c'est mieux pour tout le monde, toute la population, de viser peut-être une semaine à la fois. Ce qu'on va faire cette semaine va avoir les résultats, j'espère, des bons résultats dans une semaine, dans 2 semaines. C'est ça qu'il faut faire.
Et peut-être je peux ajouter des mots. notre effort, nous efforts maintenant, ça c'est la première chose. What we do today will actually determine how long we are stuck in this space. And maybe Jean-Yves can translate this for me in French so I don't sound like a 7-year-old. But ultimately, at the end of the day, if we don't all act together and appropriately act and take the social distancing measures that public health has prescribed to us, make sure that we are physically distancing ourselves, listen to public health, all that does is lengthen the amount of time that will we be in this situation. In fact, one of the things that I read recently that I thought was fascinating was that if we all stopped moving for 2 weeks and nobody talked to anybody for 2 weeks and we all just stayed put, in fact, we would see this virus die. That is the reality. The virus needs hosts to continue to infect in order to continue to grow. And so how long we are in this actually depends on our actions today. Dr. Tam is too kind when she says that our actions today make the difference, because what she's not saying is that each of us is responsible for the length of time that this will take for these strict measures to be in place. And that if each of us can take the appropriate measures and show the self-discipline, staying at home, really only going out if absolutely necessary, when we're out walking, avoiding people, staying 6 feet away, waiting for the next elevator if there's another person on the elevator, each of those things that we do today to practice appropriate social and physical distancing will shorten the duration in which we are stuck. So I will turn to Jean-Yves. Maybe you could translate for me.
Bien, le message est très clair. C'est que si on ne faisait rien, on se dirigerait vers un scénario catastrophique. Ce qui est vrai, par contre, c'est qu'il se passe beaucoup de choses. Les Canadiens, et ça inclut les Québécois, écoutent et respectent les directives de distanciation physique, d'hygiène de base, d'isolement dans les cas de ceux qui reviennent de l'étranger. Et les gouvernements travaillent aussi très fort, non seulement en termes de santé publique et de santé sur le terrain, les travailleurs de première ligne, mais aussi, comme on l'a vu hier pour le gouvernement fédéral, dans la capacité de production et d'approvisionnement de tous les équipements dont on aura absolument besoin au cours des prochaines semaines.
Merci, M. Duclos. Donc, 2 questions au téléphone. S'il vous plaît, opératrice, la prochaine.
Thank you. Merci. The next question is Althea Raj from HuffPost Canada. Your line is now open. La parole est à vous.
Merci beaucoup. I have some questions about, Mr. Freeland talks about, and Mr. Trudeau talks about all the money basically being available, but there seems like there are obvious gaps in the system that has been announced so far. Self-employed people who have lost not all, but a significant drop in their incomes because of COVID-19 seem to not be included. And as we heard from Premier Legault last week, people who make minimum wage may not even make $2,000 at the end of each month. I know yesterday the Prime Minister talked about working with the provinces, but can you give us an idea of what exactly is envisaged to, because people are now essential workers, and everybody recognizes it, what is the federal government thinking of doing to ensure that these people are still showing up for work and they're not being financially disadvantaged compared to people who are staying home?
Do you mind, Althea, if we give Carla the first shot at it? She has joined us by video, so it would be good to hear.
Yeah, of course. Of course.
Thank you. Thank you. Can you hear me?
Yes, we can.
Excellent. Thank you. So with respect to anyone, Althea, who has only reduced hours or reduced income, they are not the target workers for the CERB. So we are looking at workers who have lost their income completely for COVID-related reasons. Those are the workers that we want to cover by the CERB. Now, the wage subsidy, as Jean-Yves has said, details to follow very shortly through other ministers of finance and small business, is trying to address the larger cohort of workers who perhaps employers can't afford to keep on or employers have reduced hours for. With respect specifically to people who are self-employed, that is a population of workers that we are working to figure out where they fit in if their hours are simply reduced. If they have no income, they absolutely are eligible for the CERB. If your hours are reduced, we're trying to figure out how that works with how it interplays with other provincial options. But for right now, and the cohort that we're targeting through the CERB is and are workers who have no source of income.
And if I may, in addition to what Carla just said, the message from the Canada Revenue Agency, which I said in French, we can also repeat in English, because it's something very important for Canadians to prepare for their demand for the Canada Emergency Response Benefit. And it is that to better prepare for the large expected inflow of demands that we expect for the new Canada Emergency Response Benefit, we are launching today the website, which is common for everyone, canada.ca/coronavirus-CERB. We're also asking Canadians to put in their demand starting on April the 6th for the emergency benefit according to their birth month. And that is for those born in January, February, and March. Application on April the 6th. Application on April the 7th for those born on April, May, and June. April the 8th for those born in July, August, and September, and April the 9th for those born in October, November, and December.
Thank you, Minister. Althea, follow-up?
Yeah, nobody actually responded to the minimum workers. Is what exactly is the federal government working towards when the Prime Minister says it's working with the provinces in terms of ensuring that those individuals who are working full time are at least making take home $2,000. And if I could just add as a follow up, has any thought been given to giving the families of, unfortunate as they may be, medical workers who end up dying because of COVID-19 death benefits as we give to Canadian Forces members?
Carla, would you want to answer on the minimum wage and workers?
So thank you. Yep, I can. Thanks, Jean-Yves. So again, we recognize, and we didn't in any way want to disincentivize or in any way reduce the value and the contribution of people who work in essential service industries, but also who get minimum wage. We're working to figure out a way to recognize the important contributions they're making, whether that be through employer top-ups or through other means. As the Prime Minister said, that's a conversation happening collaboratively with the provinces as we try to harmonize our benefits to make sure that there aren't these gaps. Of course, as you can appreciate, we're doing public policy work that may historically have taken years in a matter of days, and as new groups are identified that necessarily aren't that haven't yet been fit into any of these benefits, we're working on that. Everything is up for grabs, is what I'm saying.
Thank you, Minister. Maybe one last question on the phone.
Thank you. Merci. The next question is from Lina Dib, La Presse canadienne. Please go ahead. La parole est à vous.
Oui, bonjour. J'aimerais revenir sur la pénurie de masques au Québec et j'aimerais avoir une réponse claire. Ce matin, M. Trudeau a dit que absolument et dans un très, très court délai, il y aurait des masques qui seraient livrés de Ottawa entre les mains à Québec. Mais maintenant, la ministre Haïdou, enfin, il y a déjà plusieurs minutes, va faire une réponse un peu plus compliquée. Alors, est-ce qu'on pourrait me confirmer si oui ou non, d'ici 2 jours, Québec va recevoir des masques d'Ottawa?
Je peux confirmer que oui.
D'accord. Super, merci pour la clarté et le fait que ce soit si court. Mon autre question, vous avez dit depuis le début que c'était absolument essentiel que le matériel médical, qu'on laisse ouvert les chaînes d'approvisionnement avec les États-Unis parce que du matériel médical vient des États-Unis et pas seulement en lien avec la COVID-19. Est-ce que vous avez, en ce moment, est-ce que vous recevez, vous avez reçu des garanties récentes de l'administration Trump, étant donné la situation qu'ils vivent et les quelques 200 000 cas chez eux, vous avez reçu des garanties que du matériel médical va continuer à être approvisionné vers le Canada, que ce soit du matériel pour la COVID-19 ou n'importe quoi comme médicaments ou autres besoins médicaux?
On discute chaque jour les liens entre le Canada et les États-Unis. On discute chaque jour le commerce entre le Canada et les États-Unis. Et on discute chaque jour la situation de santé au Canada et aux États-Unis.
OK. Donc, pas de garantie.
So, no
Thank you, Minister.
Thank you.
And that's it for today. Thank you. Merci. Ceci me fait à la conférence de presse.
That concludes the press conference.